Are you struggling with low back and leg pain where the pain's radiating to your groin and potentially radiating into the back of your leg? Then it's highly likely that you're struggling with a sacroiliac problem. So often people come to my clinic with low back and leg pains, and there's many reasons for low back and leg pain. The most common reason normally is that they're struggling with a trapped nerve in their low back from the pressure of a disc, and that nerve pain sends pain all the way down the leg, all the way into the foot. This is commonly known as sciatica, but you can also get leg pain and groin pain with low back pain from a sacroiliac joint. Now, to look at the anatomy here, you have the pelvis, the low back, lumbar 5, 4, 3, 2, 1, the ilium of the pelvis, and where the ilium of the pelvis comes together with the sacrum, it forms this joint called the sacroiliac joint. Now, the sacroiliac joint can refer pain, as I said, to the groin, but also down the leg. And the most common way to figure out whether or not you're struggling with a sacroiliac problem or a low back trapped nerve is really whereabout the pain is localized. So if when you feel the pain, it's more to one side, the left or the right, and you can feel the pain over this bony structure. If you touch your back right now, you'll feel to the side of your low back, there's a little bumpy prominence, and this is where your sacroiliac joint is. If you feel pain deep or around this area, it's highly likely that you're struggling with a sacroiliac problem. Now, when you come to a chiropractor, there's many ways in which we'll assess it to figure out whether it's your pelvis or whether it's a trapped nerve from your low back. But an easy way for us to assess you while you're actually in the adjustment is to have a look at how much your leg extends when you're lying on your tummy. And I have a small clip here that I'd like to share with you, pre and post adjustment, to a client that had a sacroiliac problem just recently.
Okay, pre-adjustment, raise your left leg as high as it goes. Back down, right leg. Back down. Okay, post-adjustment, raise your left leg first as high as you go. Back down, right leg. Back down. Clear.
The best way to correct or fix or resolve the pain in the sacroiliac joint is to really get a chiropractic adjustment where we can move that joint and get it functioning properly. The second thing that's really important to do is to put ice on the area because it gets very inflamed. It needs to be cooled down, the inflammation needs to be taken away, and icing this area over that bump for 20 minutes, 3 applications a day will really help. And then the third thing I always recommend for SI joint issues is to take a long walk where you're striding out. This will get your SI joint moving better, and consequently movement will improve the ability for it to function better and consequently improve the pain. So ice, get adjusted, and go for a long walk where you're striding out.